This is No Operating Manual, a podcast about building healthcare companies when there's no one clear path and no operations manual. My guest today is Duffy Fallon, the founder and CEO of Nosis Health. Duffy has spent most of his career building emerging technology products, working on everything from augmented reality tools for frontline workers to biometric wearables and brain-computer interfaces. But his path to healthcare is personal, drawing from his own recovery journey and his experience navigating traditional addiction treatment. Duffy founded Nosis to focus on the parts of recovery that often go unaddressed: physical health and long-term vitality. Today, we're going to talk about those experiences and how they shape the company he's building and how he thinks about care, technology, and recovery. Duffy, welcome to No Operating Manual.
Thanks, Erin. Thanks for having me.
So first off, starting a healthcare company based on lived experience can be both grounding and heavy. Tell us a bit about Nosis and how you take care of yourself as a founder while building something so close to home.
Yeah. Well, starting with Nosis. Nosis is what we believe substance use care really should have been all along. And that's an integrated health system that's focused on mind, body, and spirit. And so what that looks like for us, and one of our key differentiators, there's a few, but one of the big ones is that we're not only focused on the psychology around the drivers of use, but really the biology as well. And so for us, what that looks like is we bring together addiction medicine, advanced diagnostics, therapy, coaching, and the full continuum of lifestyle medicine to really help people heal their brains, repair their bodies, and kind of create the conditions for lasting well-being. We kind of believe fundamentally that without looking at the biology of recovery and biology of a human, recovery is kind of built on a shaky foundation. This is a condition where people are actively poisoning their body with drugs and alcohol. And I can speak for myself, but very, very few people, I think, are going to focus on more of the lifestyle pieces. So how am I eating? How am I sleeping? How am I moving when they're in active use? And so these are folks that kind of come in with all the onset to get stuff from a biology standpoint. And so our core thesis is really by focusing on health, we're ultimately going to deliver better recovery outcomes. So that's Nosis. I'm sure we'll talk quite a bit more about it. In terms of how do I keep myself grounded? I mean, I think this work is so personally fulfilling for me. I'm in recovery myself. I have so much respect for the people that we work with, from our team to our members. Anyone who's willing to kind of step through the door, I guess, virtual door, or just kind of step into changing their life in this way, it's a huge deal. And so just the ability to kind of work with those people is incredibly grounding for me. I got to say that, I definitely walk the walk. I don't just talk the talk around the things that we ask our members to do. And so things like sleep and movement and nutrition all are really important and priorities in my life. And I have a great family. I have a great girlfriend. I have a great dog, and, just a great support system around me, and a great group of friends that have been with me through the beginning. So all of those things together, I think, are really grounding, but ultimately, I love the work.
I think that's so important. I mean, you wouldn't be able to be passionate about what you're doing, especially something so personal, if you didn't love it. So you've been through recovery and you've been inside that system of recovery and you've experienced that. And so what was it that you felt like was missing that made you want to feel or build something differently?
Yeah. I mean, I think for me, I spent about 4 months in treatment throughout the full continuum. So I started inpatient residential, did PHP and IOP, sober living. And it definitely saved my life. Like it was a super important part of my journey. My experience was that after I got out, and kind of went back into the real world, I felt like crap for the first year and a half of my recovery. And I grew up with addiction in my family. I kind of knew what this looked like and where it went. I was super committed to kind of staying on the path, but it wasn't easy. I guess it was this constant conversation in my head of, hey, if you feel like crap when you were drinking, but you also feel like crap when you're sober, like it was just like, oh, well, maybe you go back. And I think when I kind of stumbled my way into an integrated medicine clinic, the doctor there kind of said something in which it sounds so simple today, but it was profound at the time, which is it's impossible to be mentally and emotionally well if you're physically unwell. And she looked at me and said, hey, I bet based off of, your use history, you're probably uniquely pretty physically unwell. And so we went through, we did a bunch of blood testing and a gut biome test and actually some interesting genetics testing as well. And sure enough, it came back like everything was wrong. I was 28 years old at the time. I had no testosterone in my body, my nutrients, my gut, like you could just go down the list. And I worked with, after about 3 months, and this sounds really dramatic, but it was like my life just totally changed. And it was by primarily focusing on how was I eating, how was I sleeping, how was I moving, what supplements was I taking, and kind of doing this blood work that was super motivating, and that like I could actually see the changes. And there was something like really tactical there that was super helpful for me. And that paired with some medication changes, I think there's a whole thread we can pull on, at least for me. And I know a lot of folks as well, like as you're going through that kind of treatment system and seeing different providers, I ended up on just kind of a cocktail of medications that wasn't supportive for me. We are like not, like medications are incredibly important. I think it's just more of like really for somebody who's like in that vulnerable of a state, like really making sure that the medications are supportive. And so in terms of like what was missing, it was really like this idea that my physical body hadn't been addressed, and ultimately that's what kind of drove the vision for Gnosis and my personal experience, and really looking out at the market as well, and kind of seeing these whole person care models popping up for whether it be diabetes, obviously oncology has been around for a while, autoimmune conditions, GI conditions, a lot of just chronic disease, but there's nothing there for substance use.
So you had mentioned that the blood work had shown quite a few different things that were just off, right? Like I'm going to go into the weeds on that one a little bit.
Sure. Yeah.
For those who are experiencing that kind of addiction or coming out of kind of addiction, can you tell us a little bit more about what specifically those blood tests were showing and the impacts that they were having on your life?
Yeah, I mean, I think a big one is hormones. Like, I think that that's for both men and women. And for me personally, like I said, my testosterone was like I was 28 years old at the time, and any male needs testosterone, let alone a 28-year-old. Like I was completely depleted. My nutrient levels, something so as simple as vitamin D, can be like a huge driver of like just overall well-being and how you're feeling. And then the gut biome test was like very interesting and eye-opening. And there's a lot of talk and research around kind of the gut-brain connection, and gut as really like a fundamental piece of like overall well-being. And uh, I'm not a doctor, and this is not my area of expertise, but like basically the diversity of organisms in the gut is like super important. And I just like had it, like it was like a nuclear wasteland, my gut. And so I think like those are three things that come up for me. And my co-founder, Dr. Eamon De La Garza, probably has quite a few more specifics, but um, yeah, for Gnosis at least, we test about 60 we test about 60 biomarkers, and that's everything from hormones to lipids and like just kind of the basic stuff, but then quite a few kind of more substance use specific biomarkers as well.
So is that really that differentiator? So like traditional addiction treatment kind of focuses on that crisis stabilization, and you're putting really an emphasis on rebuilding that health and vitality. Is it the blood work? Is what does that shift look like in practice, or how does that go hand in hand with what Gnosis is doing?
Yeah, I mean, I think that yeah, I think you said it well. Like I would say the traditional like a traditional treatment model definitely does focus on crisis management. Obviously, like, that's super important, right? Like if the house is on fire, you have to put out the fire before you can go in and repaint and do the floors and do all of those things. So like managing the crisis is super important. I think the way that we look at it at Gnosis is we what we technically do is we do medication management, we do primary care adjacent services, and then we do the full continuum of lifestyle care. And so I guess what we would say is that not only as we're addressing, like I said, it's impossible to feel mentally and emotionally well if you're physically unwell. And if you think about kind of relapse prevention as minimizing the surface area of like weak moments, like those weak moments, and when I'm going to go, like I want to go use, or like that sounds like a better plan than staying on track. And you feel like crap all the time physically, like that surface area is huge. And so from a Gnosis perspective, like what that looks like is really incorporating all the lifestyle pieces into care. So, like whereas I think most traditional models would look at, medications and therapy, like two absolutely critical, important pieces of our model as well. We would just say things like, hey, how are you moving? Are you sleeping? Like if you're like sleeping is a huge one, right? How are you eating? How are you actually fueling your body? Are you drinking enough water? Right? Like these things that like are just core fundamental building blocks for any person, let alone again somebody who is likely starting pretty significantly behind in those areas.
Yeah, I think everybody can work on those, but again, when you're in a deficit state, you probably feel it even worse. So
Totally. Yeah.
for Gnosis, you worked on technologies that, and creating usable tools, complex signals for usable tools in real world environments. So, how does your product background influence how you're working on Gnosis and how you're designing your care model?
Yeah. I think a couple things. So honestly, we design care like any software team, good software team designs software or products. And that's like starting with the user first and not necessarily the system. And I think that the other piece that comes into play there is, I don't have a healthcare background. And so I think coming in with a bit of and I have this lived experience. And so I think coming in with a beginner's mind and just kind of saying like, hey, what's actually best for the patient here? Like what is the patient experience need to look like without kind of the confines of the system that we're operating in, which there's a whole thread we could pull on there too. But I think that that's like fundamental to, and I think kind of an advantage for us is that we are really focused on the user. We're not focused on the system right now. Today we're direct to consumer and out of pocket. So that frees us up quite a bit. But I think that that's like the core thing is like we are truly designing for the user, and I think not just within understanding like the treatment experience itself, but like really the broader context of someone's life. Most of the time people have families, people have jobs, people have other things to do, and I think that that's a really unique part of the digital piece of our care model. The question then becomes like, how can we make it effective? How can we make it so that like someone's not just showing up on a Zoom meeting and sitting and not saying anything for 60 minutes? Like, is that really going to help? Right. And so really we've been super intentional about the care model, about how we design sessions, about I think we've been super intentional about the people who are on our team. The vast majority of people on our team are people in recovery themselves. And that's been a huge differentiator for us in kind of creating that relationship with patients that I think is important for any person, like to have a great relationship with your provider. But I think uniquely for people navigating substance use disorder, I think that having a real connection with a provider is incredibly important, and that it just kind of takes it a whole level deeper and when someone actually does have that lived experience as well.
Yeah, I can totally understand that. Well, kind of diving into that, you said your direct to consumer model right now. I'm assuming that you'll eventually be tied into some sort of uh, not as direct to consumer for a growth model. I guess my question for you is, what do you think is going to be the biggest challenge of implementing this within a traditional healthcare system?
Yeah, I mean, I think that for us, we believe that our outcomes will kind of do the talking, and so we don't work with a fee for service model that just like is orthogonal to the way that we to deliver care. And so our what we believe, right, is that our value proposition is not only focused around reducing things like if we're talking to a payer or an employer, for example, not only reducing things like inpatient treatment stays or ER visits, like kind of the more traditional pieces, but really we're focused on reducing the chronic disease burden. So whether it be liver disease, heart disease, metabolic disease. And so from a value perspective, right, if we're not only able to say that, hey, we're able to reduce, right, these kind of more traditional metrics, but we're also able to reduce the chronic disease burden, which for example, 70% of people diagnosed substance use disorder are overweight. And so there's like a lot of these like comorbidities that come along with substance use. And so I really think that value proposition and where we're going and the data that we're already seeing today is like a very, very compelling case. So the honest answer is I don't totally know today, but I do know, I do strongly believe and have had a number of conversations with different organizations that basically it's like, hey, if this is true, if you guys are actually able to show this and like demonstrate this in data with the proper patient population, I think our ability to get a pilot should be for sure there. So
That's
that's yes, the initial ideas.
I think that tracking of data is probably some of the hardest things to do within a healthcare setting. So it's good that you're starting now. Recovery is deeply personal and it's often not linear, but a healthcare systems, they tend to standardize. So how do you think about balancing that individual care with building something within that healthcare system that needs to scale?
This comes up a lot. So I think, not only are we doing like personalized care, but I think, like I mentioned before, it's like relational care. And so I think like the question is really like, how do we scale both those things? And the first things that come up and like, I guess it's like scaling the scaffolding and like personalizing the interaction. Like how do we scale like the scaffolding, the infrastructure, the framework? And for us, again, knowing that like, I think trust and belonging and relationship is like a key differentiator of the model. I think how we think about scale, like from more of a tactical piece, there's a couple of things that have become really interesting for us. The first thing is like group models. So we started with a lot of individual sessions, particularly for coaching. We've now transitioned to a group model, and that's honestly was primarily driven by members in the sense of like we have community groups as well. So we run about 4 groups a week that anybody in the community can show up for. And people love them. Like people love being in community. I think particularly like being around people who are also kind of going through the same thing that you are is super powerful. So moving to group models for coaching, I think is one way that we're looked like that I think, helps us, scale more effectively. I'm really excited about AI too, in terms of not, and I don't say like AI, like we're not going to build like AI to replace our coach or our doctor, but it's really AI to empower our care teams. And I think that's like really, really interesting. We're already doing that today. And I'm super excited about what that can do for us to just kind of help one of, what may have taken like 2 or 3 care team members, one have, enable and empower one care team member to be able to do. So we're already building some stuff there today, and it's been really cool.
So, on that same thread, you have worked on emerging technologies and you're seeing how those emerging technologies can help people work and function better. Where do within this, you said that helping to scale is going to be that structure, the structure of it, but where do you see the technology helping recovery itself? And when does it need to take a step back?
I guess I think that technology should make care more human and not less, if that makes sense. I think, like I said, like enabling our providers to be more effective, and being able to, like, I think that what we can do, our care is so personalized today. And I think what we can do, being able to like take all the data that we have and create personalized care plans, of course, with provider oversight, I think is really, really awesome. So that's a great way that like technology can be used and I think should be used. I don't buy at all the idea of this like an AI chatbot like serving as like the main point of contact or like fully replacing a doctor or a care provider. I think that there's a place for it for sure, but I don't think that like this like I think there's some models out there today that are like trying to create like the AI doctor and not have a real doctor interfacing with a patient, and that's definitely not what we're doing. I think things like advanced diagnostics, like these are like blood work, for example, exists in other areas of healthcare, like all over the place, but doesn't for some reason really exist in substance use disorder, like substance use care. Things like GLP-1s, I think, are super interesting and exciting for our space. There's a lot of research going on here. A lot of, I think, anecdotal evidence of we're using GLP-1s today with our patient population. And, for us, like I said, there's a significant portion of the population diagnosed substance use disorder that also struggles with their weight. And so for us, it's kind of a double whammy, right? We get, the weight loss, but we also get reduced cravings. And so like that's where a lot of the research is going. But I think fundamentally like that was what, one of the reasons like or positioning for Gnosis is that, there's a lot of amazing technology that exists out there in the world today. And for some reason, very little bit of it trickles into care for people with substance use disorder. And so for Gnosis, it's like, how can we be a very dynamic model that, brings in the most advanced technologies that are available and makes them available to this specific population?
I'm curious, speaking of the GLP-1s, because I've also read those same articles, stories about, again, addiction and cravings. And depending on where folks are in their journey, where, have you seen where people have used GLP-1s and then gotten off GLP-1s and how they've been able to still continue to be in recovery? And how does that help or hurt?
I think it's like anything, right? Like, and I think the same thing goes with medications for recovery. So like Suboxone, or naltrexone. Like, I think that the idea is really what these drugs do. And I'm not a doctor, so this is like the way that I'm thinking about it. I'm going to caveat that. I think that what they do is really give you a window. And so I think that the lifestyle changes, right? The habit changes that while you're in that window of reduced craving are super, super important, right? And so like that's what what you hear about with the typical GLP-1, right? If you just take it and you don't change anything, the moment you get off, you're going to gain the weight back, right? And so really being able to leverage that window, and why Gnosis is so powerful, right? Like we're not just providing a drug, we're providing a lifestyle plan. And so can we take advantage of that window that we have to be able to help people change their habits, change their nutrition, change their eating or their movement, so that when they do get off of them or when we do, like that they're in a position to succeed. And so I actually think that's part of the reason why our model works so nicely with GLP-1s in particular, is because I think it's not doing right by the patient to just say, here's the drug in this case, right? Like I think that we need to provide like more of a comprehensive lifestyle plan, and that's what we do already. So
That's great. Love it. So closing this out, what have you learned about building a company that you think the others who are building wouldn't know right off the bat, especially in this space?
I think that there are like a few things that you hear a lot, and then you're like, or at least in my experience, it was like, oh, those won't apply to me. Like I know what I'm doing, and they certainly have been like very true. Like the two that come up for me for sure are like just this idea of a roller coaster, and it's not like on a like 1 week you're up or 1 week you're down. It's like it can be 4 times in a day you're up and down, at least, or 4 times a day I'm up and down. To everyone, like, oh my god, this is amazing. We're doing so well. It's like, what the hell is going on? So that is something that I feel like again I was told, but was like, oh, it won't be me. And the second piece is just like the time factor. Like everything, it takes longer, it's more expensive, particularly in healthcare. I found is like there's so many layers to figure out, and so things don't always move as quickly as I'd like. But I think that's like super real, and I would imagine is real, honestly, in any business. Yeah, those are at least a couple things that come up. I think that the last piece, I guess, specific to us is like the pressure to scale. I just found, we launched in March of last year, and I found these 10 months for us, we've been bootstrapped, I mean, to be so important and to really nail the model. And I think healthcare generally is high trust, like, and then I've been biased, but I think substance use disorder care is even like a different level of like high trust. And so like really nailing the model before, like we're just, 26 is our growth year. Like we are just kind of starting to push the pedal on growth. And I think I didn't quite think about that as much in the beginning. Like I was much more interested in like kind of moving quickly, but I wouldn't change the last 10 months. I mean, I think we've learned so much and are in a position to really be able to grow confidently. And maybe that's something that, others in healthcare who are thinking about building a digital health business or healthcare business. I think that finding time to really nail the model is ultimately where I'm at, is giving me a lot more confidence to like push the metal here on growth.
That's a great story. That's a great way to end it. Duffy, thank you so much for sharing your story and all about Gnosis. And we look forward to seeing your growth.
Awesome. Thanks so much, Aaron, for having me. I appreciate it.
Thanks for listening to No Operating Manual. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and a review, and don't forget to subscribe on YouTube. No Operating Manual is hosted and produced by Aaron O'Brien of Chemistry, a healthcare marketing and communication advisory. Visit our website at choosechemistry.com.